Colon cancer, the silent threat. Are you feeling invincible in your 20s or 30s? Think cancer is an old person's disease? Think again. Colon cancer is on the rise in young adults, and ignoring the warning signs could cost you your life. Colon cancer, once considered a disease of older adults, is increasingly affecting younger generations. This trend is deeply concerning, and understanding the risks is crucial for early detection and prevention. Cases in people under 55 have shockingly doubled in recent decades. This alarming statistic demands our attention and highlights the urgent need for increased awareness among young adults. Tragically, colon cancer is now the leading cause of cancer death in people aged 20 to 49. This stark reality underscores the importance of knowing the warning signs and taking proactive steps to protect your health. The good news is that colon cancer is often preventable, especially when detected early. Understanding the survival rates associated with different stages of the disease is key to appreciating the importance of early intervention. When colon cancer is localized, meaning it hasn't spread beyond the colon, the 5-year survival rate is an impressive 91%. This statistic offers hope and emphasizes the power of early detection. However, once colon cancer spreads to other parts of the body, the 5-year survival rate plummets to a mere 13%. This drastic drop highlights the critical need for early diagnosis and treatment. Colon cancer typically begins in the large intestine, also known as the colon. Understanding the development process can help you appreciate the importance of regular screenings and early intervention. In many cases, colon cancer starts as benign polyps, small growths on the lining of the colon. These polyps are often harmless, but some can develop into cancerous tumors over time. The transformation of a polyp into a cancerous tumor can take years. This slow progression provides a window of opportunity for early detection and removal, preventing the development of cancer. Early detection allows for the easy removal of polyps before they become cancerous. This simple procedure can significantly reduce your risk of developing colon cancer. Many people with early-stage colon cancer experience no symptoms at all. However, there are subtle warning signs that you should never ignore. Pay close attention to any persistent changes in your bowel habits. This includes constipation, diarrhea, or alternating patterns of both. If these changes persist for more than a few weeks, it's important to consult a doctor. Don't dismiss these symptoms as simply a temporary digestive issue. Tumors in the colon can disrupt its normal function, affecting water absorption and stool formation. This disruption can lead to various changes in bowel habits. Diarrhea can occur when a tumor irritates the colon, increasing water secretion and speeding up the transit of waste. This can result in frequent, loose stools. Constipation can result from a tumor creating a physical blockage in the colon. This blockage can make it difficult to pass stool, leading to infrequent bowel movements. Alternating patterns of constipation and diarrhea can indicate intermittent obstruction caused by a tumor. This fluctuating pattern should be investigated by a medical professional. Unexplained weight loss is another warning sign that should not be ignored. This can occur even if you haven't changed your diet or exercise routine. Cancer can interfere with the body's ability to absorb nutrients properly. This malabsorption can lead to weight loss, even if you're eating enough food. Cancer cells can also divert nutrients to support their own growth, depriving the rest of your body of essential resources. This can contribute to weight loss and fatigue. Cancer can release substances that hijack the body's signaling pathways, affecting metabolism and appetite. This can lead to a decrease in appetite and subsequent weight loss. Blood in the stool is a hallmark sign of colon cancer. While it can be caused by other conditions, it should always be investigated by a doctor. The most common cause of blood in the stool is hemorrhoids, swollen veins in the rectum and anus. However, it's crucial to rule out more serious causes. Diverticulosis, a condition characterized by small pouches in the colon, is another possible cause of blood in the stool. However, it's still important to get checked. Always get checked by a doctor to rule out serious issues like colon cancer. Early diagnosis is crucial for effective treatment and improved outcomes. Dark or black stools can indicate bleeding higher in the digestive tract. This type of bleeding requires prompt medical attention. When blood is exposed to digestive chemicals, it changes color, turning dark or black. This color change indicates that the bleeding is occurring higher up in the digestive system. Bleeding from the ascending colon, the first part of the colon, can result in dark or black stools. This is because the blood has more time to interact with digestive enzymes. Iron deficiency anemia can be caused by chronic, low-grade blood loss from a tumor in the colon. This type of blood loss can deplete the body's iron reserves over time. The slow, persistent bleeding from a colon tumor can lead to a gradual decrease in iron levels. This can result in fatigue, weakness, and other symptoms of anemia. While colon cancer is not the most common cause of iron deficiency anemia, it must be ruled out, especially in men. Men are less likely to experience iron deficiency due to menstruation. Tenesmus is the feeling of incomplete evacuation after a bowel movement. This sensation can be a sign of colon cancer. This feeling of incomplete evacuation can be caused by a tumor pressing on the bowel wall or mimicking the sensation of stool. This can lead to a persistent urge to defecate. Tenesmus is often mistaken for irritable bowel syndrome, IBS. However, it's important to differentiate between the two conditions and rule out colon cancer. Excessive gas or bloating can also be a warning sign of colon cancer. This is especially true if it's accompanied by other symptoms. A physical blockage caused by a tumor can trap gas in the colon, leading to bloating and discomfort. This blockage can prevent the normal passage of gas through the digestive system. Tumors can obstruct digestion and fermentation, leading to increased gas production. This can result in bloating, abdominal pain, and flatulence. Colon cancer can disrupt the balance of gut bacteria, leading to increased gas production. This imbalance can contribute to bloating and other digestive issues. Partial blockages can slow the passage of waste, increasing fermentation and gas production. This can result in significant bloating and discomfort. It's important to remember that colon cancer may be advanced before any symptoms appear. This highlights the critical importance of regular screening. The absence of symptoms can be misleading, leading people to believe they are healthy when they may have undetected colon cancer. This underscores the need for proactive screening measures. Colon cancer screening is the most effective way to detect the disease early when it's most treatable. Understanding the different screening options is crucial for making informed decisions about your health. For individuals at average risk of colon cancer, screening typically starts at age 45. This recommendation is based on the increasing incidence of colon cancer in younger adults. Colonoscopy is considered the gold standard for colon cancer screening. This procedure allows doctors to visualize the entire colon and remove any polyps that may be present. During a colonoscopy, a flexible tube with a camera is inserted into the rectum and advanced through the colon. This allows the doctor to examine the lining of the colon for any abnormalities. Colonoscopy allows for the removal of polyps during the procedure. This is a significant advantage, as it can prevent the development of colon cancer. Colonoscopy requires bowel preparation, which involves cleansing the colon before the procedure. This ensures clear visualization of the colon lining. There is a small risk of complications associated with colonoscopy, such as bleeding or perforation. However, these risks are relatively low. Colonoscopy is usually done under sedation, which helps to minimize discomfort. This allows for a more comfortable and relaxed experience. Colonoscopy under sedation, a comfortable experience. Stool-based tests are another option for colon cancer screening. These tests can detect blood or DNA changes in the stool that may indicate the presence of cancer. The fecal blood test, FOBT or FIT, tests for blood in the stool. This test can detect hidden blood that may not be visible to the naked eye. Fecal blood test, FOBT or FIT, detecting hidden blood in stool. Some stool-based tests check for DNA changes in the stool. These tests can detect abnormal DNA that may be shed by cancerous or precancerous cells. Stool-based tests are non-invasive, making them a convenient option for some people. However, they are less effective at detecting polyps than colonoscopy. Stool-based tests, convenient but less effective for polyp detection. Stool-based tests must be done yearly to every 3 years, depending on the type of test. This is because they are less sensitive than colonoscopy and may miss some cases of colon cancer. Individuals with certain risk factors may need to start colon cancer screening earlier than age 45. These risk factors include risk factors for earlier colon cancer screening. Start earlier for those with inflammatory bowel disease, Crohn's, ulcerative colitis. These conditions increase the risk of colon cancer. A family history of colon cancer or high-risk polyps also warrants earlier screening. This is because genetic factors can increase the risk of developing the disease. Family history and earlier screening for colon cancer. In these cases, screening may start at age 40 or 10 years before the relative's diagnosis, whichever is earlier. In some cases, screening may even start as early as age 25. We'll be releasing an upcoming video on the causes and prevention of colon cancer. Stay tuned for more information on how to reduce your risk. Colon cancer, causes and prevention. Stay tuned for more information. Don't wait for symptoms to appear. Talk to your doctor about colon cancer screening today. Early detection can save your life. Early detection saves lives. Talk to your doctor about colon cancer screening today.